Here we are at Timeless Beauty with Dr. Fernando José Núñez Prouxl, our plastic surgeon of the team. We're going to touch base about one of the most common procedure requested by patients, facelift or face procedure. But when we talk about face, maybe it's a wide variety of procedure. So what can you tell us about facelift and maybe eyelid surgery, right? Which is one of the most common procedure.
Yeah, one of the procedures we most commonly do here is the facial rejuvenation, facelift, neck lift, and eyelids. We usually do them together. It doesn't have to be together, but it's a procedure that sometimes we do together to get enhance the best result. There are different types of facelift. We do different techniques depending on what the patient is expecting and what's the ideal technique for every patient. No, it depends on how long the incision is going to be, what type of placations we're going to be. If it's going to be just placation of mass, deep plane, numerous techniques that we do to get the best result. Eyelid surgery, if we just do it by itself, it's a surgery pretty fast, more or less an hour and a half, 2 hours, could be with sedation and local anesthesia. And it's an outpatient procedure.
More or less, Dr. Fernando, when we're facing a facelift, what is the recovery time approx for the patient?
The recovery of the facelift, more or less, the first week is the week where we have a little more swelling and bruising. Might be the week that we have a little bit more limitation, but after 2 weeks, we should be doing most of our activities. We're going to use maybe a pressure garment for those 2 weeks, but yeah, I mean, you could be doing almost everything after 2 weeks.
One of the most common questions, does it hurt after?
What patients have referred to me is that the first 5-7 days were the most uncomfortable days. Maybe it's not that much pain, but a little bit of discomfort, swellness, bruising, maybe limitations for movements, but we usually give painkillers depending on the patient's needs. I mean, we tailor all the treatments to what the patient needs, maybe some high doses, low doses, different types of medication for this could be the most comfortable we can for the patient.
I like what you said, we tailor, right? I mean, actually, even the surgery itself is tailored based on the need of the patient. And now, one last question that is all over social medias. If you've got fillers or if you got biostimulator, some people on social media are saying that you cannot have a facelift. Is it true or not?
Yes, you can have a facelift. We've operated many cases of patients with fillers and with stimulators. We just see maybe some fibrosis in some areas that where they applied these products. But yeah, there really isn't a problem with this. I mean, we haven't seen any more necrosis, any more suffering of the skin. I mean, we haven't had much problems doing this with patients with these fillers.
So in the end, no extra complications because people get filler of biostimulator. Well, thank you so much, Dr. Fernando. Anything you need, please contact us. We have our specialist in the house for any surgical procedure. Thank you.